Well, I figure I might as well get started with the Ben and Gary show. We know dentistry, and I have to say this is the first time I've done this by myself. And my partner Gary is out of town this weekend, so we'll have to be able to do this as a solo project here. But wishing for him to come back safely and soon. And last week or the last couple of times now, we've talked about digital dentistry and the advancements that we've seen and been exposed to, and or about the coming future and some of the things that we're using even now that I feel are pretty advanced. But I figured today we'll talk about the artistry of dentistry. And I guess if we're talking about artistry, we're referring to really kind of color and contour and shape. And I guess where do we start with that? How we've used it traditionally. What does that mean? Most practices, and also anecdotally, probably about 90-95% of dental practices have traditionally recorded the shade when the assistant just uses something like a little shade guide. Almost has little shade tabs. In fact, I actually have one here now, and this is kind of the traditional one that we've used for most of the time. This has about 16 different shade replicas in place, and that really does kind of allow us to be able to provide a shade that is going to give the technician an opportunity to have an idea as to what the color actually is going to be like. And from their side, they have an opportunity to mix together shades that would match this algorithm of color that you would have. But one of the biggest challenges with that actually is the fact that this shade guide right here doesn't tell you about the intensity of the actual color, the brightness, the texture. And that has to be communicated either in a written form or verbal, a little drawing that might be done. And that's worked for years, but quite frankly, it's not usually enough information because there's a lot of subjectivity that's involved with being able to develop a great result. And so we've used other techniques to be able to create that great look, or be able to communicate that information to our technicians, which are remote from where we are. And that's been simply just using the lighting that are around here. We know that the lighting that typically light bulbs are used are not mimicking what the sunlight actually is. So we advanced to being able to get more expensive light bulbs to be able to give us daylight within the office, and then making sure that the technician on the other side has the same lighting that we're trying to visualize in the same way and communicate that information to them so that they can begin to make an outstanding result. You can imagine just by what's seen on a bit of paper, and then also what's using the lighting to be able to make sure that you're seeing it correctly. Is useful, but without another image, another tool such as say a photograph, and we used to use traditional photography, which would take forever for it to be developed. Now, of course, we have digital cameras, and I just brought along a couple of examples. This is one of our more elaborate cameras here that has a flash setup here that's specifically set up for macro or close-up photography. There are other examples as well that we have that are, you don't have to get a fancy Nikon here, but that has an ability for us to be able to, see, being able to get with the technician to be able to see what we see, and that even can be a tremendous advancement. However, cameras see things differently, and whether you use one camera versus another, it doesn't really give you what your eye actually sees, and so. We've actually advanced on to another thing that helps us with this digital shade guides. This one here is one that is just applied directly onto the tooth surface, and from there a digital readout is given. This isn't the only one on the market. This one's by the company Vita. It's called the EasyShade Compact. We've been using this one for years, and what's cool about it is that digitally it will send out a pulse there to be able to on the actual tooth. It actually uses its own color-corrected lighting that is emitted from here, so we get a much more accurate and calculated result. And then gives us out often a little readout that kind of almost gives us a mapping of what color in a certain zone of the tooth actually is like. Well, that's worked for us great as well, and it's terrific, because all these tools that were just described are about being able to transmit or translate the sense of what it looks like, what we're seeing, and whether it be with a digital shade guide, whether along with the traditional shade guide, a digital photograph, and communicate it to the technician, writing down what color is and mapping it out are all wonderful. This is what traditionally we've done. However, where I have to say the final frontier really honestly is having your technician actually in the office where the patient is actually located. Because quite frankly, you can't really just describe exactly what you see remotely and then have the person who is making it in another location give you what you think you're going to be able to see. And that is a difficult thing to do, and it's very subjective. Whereas the things that we just described kind of give us a further information, but there's no substitute for being able to have the same individual that's going to fabricate the outstanding result that we want, that the patients want, that we tend to promise that we can actually deliver, unless that individual is actually in the office under the same lighting and actually using the same tools. And once we're able to combine that and have that actually in the office, our ability to be able to develop and produce and deliver an outstanding product, an outstanding result, lifelike, has been a game changer for us. And I'd say that's our greatest advantage as restorative dentists, as a prosthodontist, that having an in-house technician, in-house laboratory where the restorations that we are looking to deliver are fabricated directly by us, and in-house where our technician can actually see the patient under the same lighting and get far more information to be able to give the patient the personality that their teeth actually give them. So it's really a tremendous advantage for us, and has really changed our ability to be able to deliver an outstanding result. Because just painting by numbers is not going to give you artistry. You can't paint by numbers and create a Mona Lisa. It has to be very specific, and it's very subjective, but we're using technology to be able to make it far more predictable and less subjective. However, there's just no substitute for the artistry that's involved in it, and the passion that goes into it for them to be able to see the patient directly and deliver in the end just creates a much better result. So artistry makes the difference between being able to deliver an outstanding, unique, astonishing, beautiful result versus one that's just average. So today, that's just a little bit about how we were able to provide our outstanding results, a little bit of looking behind the curtain, behind seeing what's going on here in the Wizard of Oz. We call Smiles International, where we're making miracles and creating stories and fulfilling people's dreams on a regular basis. And this is how we do it. We do it through science and artistry to deliver the best for you that's going to last the longest. So I hope this is enough for you guys today. I'm looking forward to being able to have my partner back in line with us. Gary, thanks so much for supporting me in so many ways. I'm looking forward to having you back in the office with me and doing our next show next time. And, this is the next and most recent episode of the Ben and Gary Show, We Know Dentistry. Please send us your questions. We're looking for you. We're looking for more ways to be able to help you, because as I've said many times, I can't answer those questions when I have my hands in your mouth. So this is the opportunity to be able to do so. Find us on Facebook, and find us on, I believe now, Instagram, as well as also our Twitter account, and look for us in that way. I'm looking for your questions. Have a good one.